Just a minute. And we need to discuss this topic. So please, sorry, anti-transpirants. Okay, we have seen in transpiration there is a tremendous loss of water, a huge loss of water is there. Plants transpire up to 98 to 99% of absorbed water, and a very insignificant amount of water is being utilized for its own purpose, for its own metabolism. A limited amount of water is used by plants. So it becomes necessary to reduce this rate of transpiration, because transpiration is popularly called as necessary evil. In one hand, it is useful process, but in other hand, it is very disadvantageous, demeritorious process. So it becomes necessary to reduce the rate of transpiration, especially in case of high-priced field crops, or in case of seedling transplantation, or in case of cut flowers, which have to be kept moist for a long period of time. So this can be done by using these anti-transpirants. Now, so in recent years, the efforts on these lines have been made to find the substances which decrease the rate of transpiration, but at the same time, they maintain gaseous exchange process, normal gaseous exchange process, because it is very obvious. We know when stomata are open, transpiration takes place. When stomata are closed, transpiration is absent. So if we can artificially close the stomata, then ultimately there will be no water loss. There will be no loss of water in the form of water vapors through the stomata. But when the stomata become totally closed, that will also affect negatively the process of gaseous exchange, because the same pores, the same stomata are used for the exchange of carbon dioxide and oxygen, which is required for photosynthesis and respiration process and normal growth and development of the plant body. So that normal process of growth and development, that normal process of gaseous exchange should not be affected. At the same time, the process of transpiration should be minimized, resisted, inhibited by use of some substances, and such substances are called as anti-transpirants. That is, the substances or any material that is applied to plant for the purpose of retarding transpiration, for inhibiting, for reducing transpiration. At the same time, it should not have any adverse effect on the normal, usual gaseous exchange process or overall growth and development of plant body, and such a substances, such a material is called as anti-transpirants. Now there are some of the examples of anti-transpirants, such as colorless plastics, then your silicone oil, then some low viscosity waxes are some substances. Then there is PMA, phenyl mercuric acetate. Then there is a inhibitory hormone called as ABA, acetic acid. Then there is your carbon dioxide gas, just now we have studied. And there is one more substance called as aspirin. So these are some of the examples of substances which are called as anti-transpirant substances: colorless plastics, silicone oil, low viscosity waxes, PMA, ABA, carbon dioxide, aspirin. These substances reduce the rate of transpiration. At the same time, they don't affect the process of gaseous exchange adversely. Now, of these substances, the first three you can see, that is colorless plastics, silicone oils, and low viscosity waxes. From that list, these first three substances form one group of substances as a spray, because when these substances are sprayed on the surface of leaves, they form a thin film. They form a thin film on the surface of leaves, so that causes partial closure of stomata. But these substances are having some limited success. So some new substances or different substances are also used as anti-transpirants, and these are, we have seen that list. So this is that substance. Can you guess the structure? This is phenol mercury. This is CH3COOH, acetic acid group. So this is phenyl mercuric acetate, PMA. This is a fungicide. This is a toxic substance. But when this substance is used in very low concentration of 10 raised to minus 4 molar, then it is having less toxic effect on the leaves, and it causes some partial closure of stomata for some week for 2 weeks, for 2 or 3 weeks, it causes partial closure of stomata when used in very low concentration of 10 raised to minus 4 molar. This is anti-transparent substance, phenyl mercuric acetate. It is fungicide. The next substance you can see here. You may not bother about the structures, but just for the sake of your convenience, for understanding purpose, I have drawn these structures, and those who are interested in structures also they can mug it up. So this is structure of ABA, inhibitory hormone called as abscisic acid. Just now we have seen in Leavitt hypothesis, this hormone is very active during the night time in dark period or in acidic pH, and this hormone is responsible for the closure of stomata during night time. By subsequent events, when this hormone becomes active in increased carbon dioxide concentration, stomata becomes closed. So we can use this substance synthetically as an anti-transparent substance. So this is another substance. Then there is one more example of anti-transparent. You can imagine this structure. This is a very simple structure, and this is the structure of carbon dioxide chemical formula, CO2, carbon dioxide. And this is also acting as, this carbon dioxide gas also acts as an anti-transparent substance, because just now we have seen during night time this carbon dioxide concentration increases, and this increased carbon dioxide concentration is responsible for abscisic acid to become active. Therefore, carbon dioxide is responsible for subsequent process, by subsequent steps, it is responsible for the closure of stomata. So this is anti-transparent substance, carbon dioxide. When carbon dioxide is used, when we increase its concentration up to certain extent from its normal of 0.03%, this is the normal percentage of carbon dioxide in the air, 0.03%. If we increase this concentration up to 0.05%, then this will act as an anti-transparent, and it will cause partial closure of stomata. More than this concentration cannot be used, because it will cause then total closure of stomata, and that will affect adversely the process of gases exchange. So we can increase carbon dioxide concentration in the environment, in the surrounding of the plant body, up to 0.05%, and in that case it will act as an anti-transparent. But this is possible only in case of greenhouses or polyhouses. So that is the limitation of using carbon dioxide as an anti-transparent substance. This is another substance which is called as, aspirin or salicylic acid. That is another name. And this is, acetyl salicylic acid. So this is also used as an anti-transparent substance. So many anti-transparent substances are available in the market, but nowadays one ideal anti-transparent is available in the market under the trade name of kaolin. So this is the chemical component or chemical constituent of that kaolin, which act as an ideal anti-transparent because it act as an anti-transparent. It causes partial closure of stomata, as well as at the same time it doesn't affect the process of gaseous exchange adversely. So these are some of the anti-transparents which are used to reduce the rate of transpiration. Okay. Again, I will request, if you have any questions, you can ask. You are free to ask questions. Please feel free to ask questions. Any questions? At the moment, if you are not having questions, you can also post your queries in our WhatsApp group or the email which I have provided you in the very first slide. Okay, thank you very much for kind or patiently listening.